Good morning everyone. I am Rahul Nanubhal, COO at Cureka.com, and today we are going to have our Instagram live session on overcoming cavities. So as we are starting with the session, let me tell you a little bit about Cureka. Yesterday at Cureka, we launched two of our major brands, which is the Good Hygiene Company, TGLC, and Health ETC at Wicked Cinema Awards. Do check out our latest Instagram videos and find out more about our brand launches. Now coming back, I'm glad to welcome with us today well-known maxillofacial dental surgeon, Dr. Pathumai. Dr. Pathumai, thank you so much for joining us today. Right. So our topic for today is overcoming cavities, and numerous people have got cavities in their teeth, and these are sometimes very painful, and people do not know what to do about them. So let's take the first question as to what exactly do people know about cavities. So doctor, how dental caries are formed?
As we all know, this is a very common problem that every one of us face. The thing is, like whenever we have something to eat, whenever we have our food, what many of us do is we forget to wash our mouth, we forget to brush our teeth after twice a day. So what happens is the clog or the food substances will stick to your teeth. So they, over time, there's an action by the bacteria. The bacteria called Streptococcus mutans, they act on the food sticking on the enamel of the tooth, the outermost covering of the tooth. They attack the enamel. They first produce the acids on the food, and these acids attack the enamel, soften the enamel, which ultimately results in what is called as a dental caries.
Right. And what are the early warning signs that people can identify caries or cavities with?
Okay, so as I told earlier, so what happens is the acid attacks the enamel, and the enamel is demineralized. So there's always, the first appearing signs is a layer of demineralization, which is witnessed as a white speck or a brown speck. So these are the initial symptoms. This happens when it comes on the enamel. So when it comes on the enamel, you may be asymptomatic at first. First you may not feel anything, but following invasion, as caries progresses, you may feel sensitivity. Once it reaches the dentin and following which it reaches the pulp, you may get pain. That is when you get pain.
Okay.
Dentin and the pulp, when it reaches,
Yeah.
you receive a pain. This is a warning signal.
Okay.
Even a sensitivity, mild sensitivity is a warning signal.
Warning signal.
The first most signal is a white speck or a brown speck.
And when you get that early warning sign, what you should do, doctor?
You should reach out first. First thing is you should reach out. You should have proper oral hygiene habits, like brushing twice a day. Okay.
Yeah.
And you should use fluoridated toothpaste. And when you reach us, we would see how much is the warning sign, and we'll see whether there's a chance for remineralization.
Right.
So once it is limited only to the enamel, then there are chances that you can reverse the disease itself.
Okay.
There's a chance that you can remineralize using a fluoride gel or fluoride varnishes or high fluoridated toothpaste.
Yeah.
And you can, without a filling or without any invasive procedures, you can still save the tooth.
Right. So reach out to the doctor as soon as possible to avoid any advanced stages of the procedure. Maybe it is very much possible to reverse the disease and to try to overcome it at very early stage. So reach out to the doctor first, and then take care of your oral hygiene is what doctor suggests. So moving on, and guys, one more thing, very important. You guys have any questions around your dental health or cavities? Please do write in the comments below, and we will take them in during this session. So can cavities, doctor, heal on their own?
Yeah, just now I told, right, not completely on their own. You need to do something for them to heal. So in the early stages, you can remineralize it. Remineralization will be via good oral hygiene fluoridated toothpaste and fluoride gels.
Right. And what happens, doctor, if we have a cavity between the teeth?
Between the teeth, initially you may not be able to see it. It will go completely unnoticed. It's mainly because of clog accumulation between the teeth. These are called as interproximal caries. So initially you may not see them, Even the white specks may go unnoticeable, but sensitivity can happen. And as the disease progresses, as the holes appear, you'll have more and more food lodging in between the teeth.
Oh, okay. And that may cause it to prolong and it to cause even bigger cavities, right? So, can a person treat cavity at home? Are there any home remedies that they can use?
No, we may prescribe you a very high fluoridated toothpaste.
Okay.
So what happens here is fluoride. The enamel is generally formed of calcium hydroxyapatite crystals, which is stronger. So this is what is being broken down by the bacteria. So when you add a fluoride to it, the structure changes. It becomes a fluoride incorporated mineral, so which is much stronger. So you can do that. Other than that, you can diet modifications have to be done.
Okay.
You have to restrict sugars.
Yeah.
Restrict sugars. Restrict refined carbohydrates. You restrict your sweets, candies, beverages. Beverages means soft drinks, aerated drinks. All these have to be.
Junk food.
Junk foods have to be stopped.
Okay.
And it's wiser you go for more fiber-rich foods.
Okay. So people who tend to have sweeter tooth, right? Do they have a higher probability of getting a cavity as compared to others?
Sweeter tooth.
Tooth means people who are more,
eat more
people
chocolates.
like more sweet things or chocolates. Yeah.
Yes, they do.
Yeah.
For them, it's better you after every I cannot tell them to completely avoid it. So it's not possible for such people. You can restrict it. You can restrict it avoid having them between meals. That is when we don't properly wash our mouth.
Yeah.
So avoid them between meals, and you can restrict them. More important.
Okay.
And after having them, wash your mouth or brush your teeth.
Yeah. Okay. So after you are having anything sweet, wash your mouth and brush your teeth. That's very important. And have in limited quantities. So let's move on to our next question. What happens if you get a cavity under a filling?
Okay. So cavity, when you get a cavity under a filling, the tooth itself may look blackly discolored. So you may not see a cavity outside, but when it's underneath, it's like the cavity is spreading from inside out. The entry point may not be visible to you. So the tooth may be blackish discolored. The tooth will be weak. It will break down the filling, and the tooth may break down when you are having or munching anything. So all those can happen. And finally, the last step would be pain.
Oh, okay. Right.
Sensitivity and pain.
Right. So when you get those early signs, we should go and visit a dentist. Right. Okay. So how long can we keep a cavity untreated, doctor?
It has to be treated as early as as soon as it is detected, it has to be treated.
Okay. Okay.
Because the earlier you do it, the less tooth structure is lost. You can preserve a lot of tooth structure.
Okay. Okay. And
when you wait, it's going to progress bad. You're going to lose more of your tooth structure. Your tooth is going to become weak, and if it goes deep enough into the pulp itself, you may have to do a root canal.
Oh my. Okay.
And finally, even if that is not possible, then you may have to remove the tooth.
Right. So we'll take up the RCT and we'll take up the dental major issues in our next session. We've also got a doctor's consultation platform by the name of Second Opinion, in which you can consult with the doctor online, and we'll take them up in our coming sessions in Second Opinion. Now, what do you do when we have a cavity pain, doctor?
Cavity pain.
Yeah.
Visit a dentist.
We have to visit a
Have to
dentist.
visit
Any
a
particular medicine at home or home remedies that we can consider?
Home remedies, it's like many people are allergic to so many medications. So while prescribing or self-prescribing, you need to take caution. So maybe immediately you can go for a pain relief if you're not allergic to it.
Okay.
But this is especially if it's at night.
Yeah.
And the next day plan a dental visit.
Okay. People do try out some ideas because, like you mentioned, sometimes it happens at odd hours where it is not possible
Some
to.
people place clove oil, clove that they do place.
Yeah.
That's just for the pain relief.
Some
It's not
ice
going
pack
to-
or something also would help. No. Okay. So how long, we've covered this question, so how can parents help prevent cavities in their children's teeth?
Parents have to monitor their child's brushing.
Mm-hmm.
They have to coming to parents, you can divide the class as parents who have infants,
Mm-hmm.
kids who are being breastfed, having milk feed, and who can take foods.
Mm-hmm.
So for those kids who are being breastfed,
Mm-hmm.
so right from the start, you have to, after every breastfeeding session, you have to wipe the gums.
Okay.
That is there. And even after the tooth erupts for them, they'll have to start brushing.
Okay.
Even after the first tooth starts,
Okay.
it's better they start
At
brushing.
what age, doctor?
6 to 8 months, the first tooth.
You should
will
start brushing it
as
at that
soon
as
as
soon
the
as possible.
tooth starts
Okay.
erupting.
Okay.
And
Yeah.
the paste of choice, since the kids are very young,
Yeah.
it's better we go for a non-fluoridated, because they
Okay.
cannot spit.
Yeah.
And you can go for fluoride substitutes as for drops.
Okay.
But as the kid grows and as the kid can spit, swallow, they can spit the water
Yeah.
or whatever, and
Yeah.
that is the time when you need to shift to a
Yeah.
fluoridated.
Understood.
And as I already told previously, just a pea size of it would be enough.
Yeah.
And proper brushing technique is important.
Mhm.
Parents have to monitor their children brushing their teeth twice a day
Mm-hmm.
with a fluoridated toothpaste.
Okay.
And if there's any spacing in between the two, they can use incidental aids also.
Incidental aids. Okay. So just
And more importantly will be the diet restriction.
diagnosis.
Diet what the parents give the children.
Mm-hmm.
So restrict them on sugars,
Mm-hmm.
encourage them to have more of fiber foods.
Fiber
Rich.
foods.
Because fiber rich foods itself helps in the cleaning action.
Cleaning action. Correct. Right. Right. Okay. So does people parents should take their kids to dentist at that early stage in case they feel that there is a pain in their teeth?
Yes,
Okay.
they have to.
Okay.
So the time for the first dental visit for a child would be around 6 months after the first tooth erupts.
Okay.
So right then,
Okay.
that will be a regular checkup.
Okay.
And if there's any pain, then they should right away.
Okay. Okay. So, what are the signs and symptoms of cavities in children's teeth?
Same as that.
Right.
It's
Same.
going to be the same.
Same.
White specks or brown specks initially.
Yeah.
And then as it progresses, you may have sensitivity.
Mm-hmm.
More deeper, will result in pain. Sometimes even swelling.
Mm-hmm.
Even we have a swelling in the cheek.
Mhm.
Even that.
Mm-hmm. Okay. So, when we talk about children specifically, what are the common causes that the kids may have cavities?
Same as that of adults. High chocolate intake,
Yeah.
sweets, candies, aerated drinks,
Mm-hmm.
soft drinks,
Mhm.
all these can cause.
Right. Okay. So, what foods and drink, like you mentioned, all these
Yeah,
things
all
you
these
should
things
avoid
include, yeah.
to avoid any tooth decay. Okay. And how often should one should visit a dentist for a checkup to avoid any tooth decay?
Once in every 6 months.
Okay. So periodically we should go and check with the doctor every 6 months to avoid any early signs or any signs of cavities. And what are the best treatments in case it is aggravated for tooth decay or cavities?
Okay. So as told, if it's only with the enamel,
Mhm.
then you can try remineralization, fluoride treatment.
Mhm.
Once it progresses, it's very deep into the enamel or it has reached the dentin.
Yeah.
That is when you start getting a sensitivity.
Mhm.
So then you can go for fillings.
Okay.
So previously the old age treatment was to go for mercury fillings.
Yeah.
But this era is more prone towards aesthetic fillings.
Okay.
So you won't know that it has been filled.
Yeah.
It's been filled. And you have glassinomer cements for
Mhm.
filling. You have light pure essence for filling.
Mhm.
So if it goes more deep,
Right.
if it goes deeper,
Yeah.
deeper, for kids you can try calcutomy.
Mhm.
For adults you go for root canal treatment.
Right. Right.
And if that is an instance where it's in the margin. Like you do not know whether it's gone into the pulp or whether it's still in the dental.
Yeah.
That is where we try giving temporary restorations. We wait for a period of 1 month, see how he's responding. If the pain progresses, we go for root canal. If not, we can proceed with the things.
Right. Okay.
The last thing where nothing could be done, we go for tooth extraction. Tooth extraction.
Right. And that should be completely avoided at all costs, because once a tooth is, I think, extracted, you cannot replace it like it is, like in its original shape.
Nothing is as good as
your original ones, right? So do take care of your dental health and oral hygiene, and go check with the doctor once in every 6 months. Guys, we have got cureka.com, which is a doctor's recommended healthcare platform, and it is your guide to a healthy living. You can connect with doctors for free using our WhatsApp platform. You can ask as many questions as you want, and around your good health, around your any concern, any questions you have which you want to ask doctor and you are hesitant to ask the doctor, or probably you have to travel a long distance to meet a doctor. We are there for you. We are there for you always. You can reach to us at the comfort of your home, or whether you are in office, you are traveling, you want to talk about your parents. Just reach out on our WhatsApp platform for free, and we will connect with doctors and come back to you with our response. Cureka.com has been started with the vision of providing free assistance to people across India through our own in-house doctors. And we have got multiple platforms, multiple brands, which is having a complete ecosystem of good health. Second Opinion is your online doctors consultation platform, which has got numerous doctors from across India, which you can consult from the comfort of your home or office. And then we have got wonderful brands that we have launched recently. Health ETC. Health ETC is your fun way of a healthy living. It's like using gummies or healthy nutritional supplements for your healthy living. They can take care of your any concern, whether it's your women health, whether it's your dental health, your hair health, your immunity, your sleep, all in a very fun way. You'll enjoy popping up a gummy at the same time, which will give you a lot of nutritional benefit. Similarly, we've got TGHC, which is your healthcare brand for your skin care, hair care, body care, food care, and we've got superior quality products which are plant-based, biodegradable packaging, and all these products are being curated by doctors in their own labs, tested, verified, and they are going to reach out to you. So do check out our platform. Yesterday we have launched our TGHC and Health ETC brands at Brickerton Cinema Awards. The video will be coming out soon. It was a grand event. We were in between celebrities, and all of those appreciated the products fabulously, right? Do check out our Instagram handle, do check out our social media channels, and you will get latest updates about them. So that's it for today. I thanks so much to Dr. Pathumai for coming to our platform again and answering our queries and helping you lead a healthy living. So thank you so much, Doctor.
Thank you.
Yeah.